Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saracito is interpreting the press conference in Spanish. This interpretation will be available on the county's website and YouTube page shortly after we conclude this press conference. Governor Newsom announced today that schools may not reopen for in-classroom instruction until counties have been off the state monitoring list for 14 consecutive days. Unfortunately, COVID-19 positive cases and hospitalizations continue to increase in Santa Barbara County this past week. Positive cases and hospitalizations throughout the state of California continue to increase. Our county has now been on the state monitoring list for 32 consecutive days. 32 counties in the state, including Ventura and San Luis Obispo County, are also on the state monitoring list and are subject to the governor's order regarding schools. Every geographical area of Santa Barbara County is experiencing increased COVID-19 positive cases. The governor's announcement about schools and our own local communities increasing cases, hospitalization, and ICU capacity should give us pause. We need to do more and quickly to stop the spread of the virus and create a path to reopen our schools. I want to focus my remarks today on the high-risk contacts that come from the 3 C's: closed spaces, crowded spaces, and close contact. We all know COVID-19 is very contagious. The virus is spread from one person to another through the very small droplets that are exhaled by positive individuals, even when they are exhibiting no symptoms. There is no way to tell if someone has COVID-19 other than a test, which only indicates the condition of the person at that specific moment in time. The fact the spread of the virus is invisible makes stopping community spread and containing the virus very challenging. Every contact between people creates some risk, but different contacts pose different degrees of risk. Understanding this range of risk is very important to help each of us understand what we need to do to effectively stop the virus. When businesses were closed and we were still home during the first stages of the pandemic, we had very few high-risk contacts with other people. We flattened the infection curve together by staying home away from other people and reduced the spread of the virus successfully. As businesses have reopened and we've again begun mixing together, higher risk contacts have increased and the virus is again spreading in our community. We let down our guard and became complacent about avoiding closed spaces, crowded spaces, and close contact. We can slow the spread of the virus, keep businesses open, and reopen our schools and the businesses that have been required to close if we focus our attention on eliminating high-risk contacts. The highest risk contact occurs indoors when people are together for more than 15 minutes without wearing masks. If you think about when this occurs the most, because of the amount of time involved, work is the first place that should come to mind. It's easy to think your coworkers are part of your personal bubble and do not pose a threat. That's not true. We spend a lot of time indoors with our work colleagues. If you work indoors and are closer than 6 feet apart and are not wearing masks for longer than 15 minutes, this is a high-risk contact. Similarly, because it's indoors, if you have friends over for dinner inside, even if it's only another couple, this is a high-risk contact. If your friends or relatives come for a visit and you sit together inside and talk for more than 15 minutes without masks, this is a high-risk contact. Contacts that take place outdoors, because they're not in a confined space, are much lower risk. If you walk past a person outdoors who's not wearing a mask, that is a lower risk contact. The risk outdoors increases when people are close together, and it is even higher in crowded situations. Walking past people without masks in a crowded area is higher risk than walking past a single person on the sidewalk in your neighborhood. If you're outdoors without masks close together for a prolonged period of time, the risk also increases. Gatherings of friends or family outdoors without masks close together for a prolonged time is a higher risk contact. To be very specific, outdoor parties, family celebrations, barbecues with people who do not live in the same household without masks for an extended period of time is also a high-risk contact. Yesterday, Dr. Robert Redfield, director of the Centers for Disease Control, said the United States could get the coronavirus pandemic under control in 1 or 2 months if every American wore a mask. The time is now, Dr. Redfield concluded. If we want to get our kids back in school, if we want to keep businesses open, if we want to reopen the closed businesses, now is the time to wear a mask and keep 6 feet away from others. We've all learned about wearing seatbelts saves lives. Statistically, the greatest risk for car accidents is when we are close to home in neighborhoods we're familiar with and we let our guard down. Unfortunately, the same thing is happening with our daily interactions with others. We're slowly getting comfortable again with getting together with other people in what we perceive are low-risk situations. Many of these gatherings are not actually low risk. Like wearing a seatbelt, we need to get used to the idea that wearing a mask when around other people, especially family and friends who live outside of our household, saves lives. We can stop the spread of the virus again by working together. We've done it before, and we can do it again if we each do our part. The easiest thing to do is to wear a mask when in contact with other people. Please pay special attention and focus on the 3 C's: closed spaces, crowded spaces, and close contacts. These higher risk contact environments need our close attention. We'll now hear from Dr. Von Reynoso, the county's public health director.
Thank you, Supervisor Hart. Good afternoon. Today, we are reporting 137 new cases. We currently have 394 active cases in our community, and 89% community cases have fully recovered. Currently, we have 81 people hospitalized, with 27 in the ICU. Santa Barbara County has been on the state monitoring list for 32 days. The state monitors all counties for the average number of tests per day, elevated disease transmission as indicated by case rate and testing positivity, increasing hospitalization, limited hospital capacity as indicated by percent ICU beds available and percent ventilators available. Today, our county continues to be on the monitoring list for having a case rate that is 10 times higher than the state's acceptable threshold of 25 cases per 100,000. Our testing positivity rate is at 9.6%, which also exceeds the state's acceptable threshold of 8%. We are steady in our hospitalization rate, and we are meeting the state's threshold for available ICU beds and ventilators. Our epidemiology team has provided a snapshot for us for this week's cases and where they're originating. In the past 7 days, of the 526 cases we've interviewed, gatherings continue to be a significant issue. 12% of the cases reported attending a large gathering in the past 14 days. Description of other and gatherings include work, bars, grocery stores, gyms, lake gatherings locally and out of county, beach gatherings out of county, barbecue gatherings, funeral, and birthday parties. There's been a lot of questions about enforcement actions in our county. I'd like to report that since March 15th, Public Health has handled 352 complaints from the public, with the vast majority related to food facilities. Every one of them has received a phone call and at minimum, and most have received a site visit. We have issued 4 notice of violations. We've issued 1 notice of intent to suspend permit. We've had 1 hearing, and it all resulted well. In addition to the Environmental Health Services inspections, we are aware that the governor's COVID-19 enforcement team have been visiting ABC licensed businesses in Santa Barbara County. They are taking enforcement actions for the following violations: employees not wearing masks or wearing them improperly, businesses not enforcing physical distancing requirements, and businesses exercising privileges indoors when they should be closed. As your public health director, I am worried about our increasing case rates and test positivity rates. Both of these will ultimately have an impact on our hospitalization rates. Because we continue to be on the monitoring list, I anticipate further modifications from the governor. As we will hear later from our school assistant superintendent, as a county, we are restricted in opening schools because we've been on the monitoring list for more than 14 days. And the governor is looking broadly at the state and will be making modifications in the reopening efforts in order to affect significant change. So it is critical that we work together as a county, as a community, to decrease the growth in new cases. I'm asking everyone to do your part to take action so that, for instance, our kids can safely return to school in person. Please commit to 1, wearing face covering, 2, maintaining physical distance, 3, wash your hands, and restrict gathering with non-household members, as Supervisor Hart described. All these actions are critical, as we know 42% of our cases are from community spread and 50% from person-to-person contact. So here's the bottom line. If you cannot maintain a 6-foot physical distance, you shouldn't be there, period. Thank you.
Thank you, Dr. Dorenoso. Next, we have Dr. Lynn Fitzgibbons, Cottage Health's infectious disease specialist, to talk about the capacity of our local hospitals. Welcome, Dr. Fitzgibbons.
Thank you, Supervisor. And thanks for the opportunity to connect with everyone today. The end of the week, a good opportunity to reflect on where we've come from, but also what might be ahead. As an ID physician, I would say we are clearly seeing COVID-19 regain momentum in our county. In recent weeks, we've seen record high case counts. We continue to see more and more patients admitted to our hospitals with serious and life-threatening complications of this awful infection. And tragically, now more than 30 people in our county have lost their lives. It's important to note, though, that things are very different now than they were in March. This is both encouraging, but also concerning. We know, for example, that we can do it, that we can respond together to bring down our cases. We also know that this challenge will be with us for a long time, and unfortunately, herd immunity might not be an imminent solution. When this epidemic first hit our region in March, we committed and aligned ourselves as a whole community against this virus. We took extreme measures with closures and isolation, and we absolutely controlled our curve. Unfortunately, however, the pandemic persisted. What were only a small number of community transmissions in early May ultimately took a strong foothold in our community by early June. At this point, of course, we now know we have widespread community transmission. So what can we do to control our curve again? I believe if our whole community acts together, as you continue to hear from all of the panelists today, that we can do this simply, and I hope without having to stop our lives again. We must adjust our distancing. We must consistently wear masks, and we must frequently wash our hands. If we all do these 3 simple things, and all continue to remind one another to also do these simple things, we will control our curve. We should avoid close contact with people outside of our household as much as possible, particularly with anyone who is older or more medically fragile. Close contact, as you've heard, usually means being within 6 feet in an enclosed indoor space for 15 minutes or longer without the use of masks. We can all do our part by keeping space from others and using masks routinely. Masks are our friends here. There have been lots of discussions about masks, in part because until earlier this year, those of us in infectious diseases had not had such a perfect opportunity on the volume of millions of people to really study their benefit. Now we truly know that masks and face coverings work. Let's use them. In other encouraging news, compared to March, we simply know more about COVID. The best and the brightest around the world have focused intently on understanding this infection for over 6 months now. And today we understand how to diagnose, how to treat, how to prevent it better than we ever did. We've made progress with treatments, but we are still without a medication to prevent infection, and perhaps most importantly, still without treatments to consistently save lives. Unfortunately, we also understand more about how our immune system responds to this infection. And like other coronaviruses, which many of us catch year after year, we are starting to understand that protection after this infection may not last long. In contrast, if a town suffers a measles outbreak and most are infected, then most in the town will be protected the next time measles enters town. Unfortunately, with COVID-19, we now know that some people either fail to make neutralizing antibodies, and some, after only a couple of months, seem to lose their neutralizing antibodies, perhaps leaving them vulnerable to catching this infection again, and perhaps telling us that herd immunity, where a whole community becomes protected, may be very difficult to achieve. What does this mean to me? This means, again, this infection will be with us for a long time, and that the changes we are making to how we interact and safely live our lives are going to continue to be critical. Around our state and here in Santa Barbara County, the recent events have led us to important conversations about our health system's capacities, which is, of course, much more than simply a bed or a cot count. For every patient in a bed, we must be able to safely provide care, and care involves lots and lots of things. It involves medications, PPE, equipment, resources, and people. Our incredible healthcare workforce, both in hospitals and outpatient settings, bravely and consistently show up to work every day. This includes, in Santa Barbara County, thousands of hardworking community members, perhaps, I think, our most precious resource. Our nurses, our lab techs, our doctors, our staff in radiology, food service, cleaning, and others. But these are also our neighbors and our friends, and unfortunately, that makes them also vulnerable to this virus when it's moving so indiscriminately amongst our community. The weeks ahead are clearly going to be filled with challenges. Like many things in public health, the victories are often elusive and sometimes go unrecognized. And so I would like us to focus with a gratitude to our health department, to our county, and focus on the success that we have already had through this epidemic. We absolutely flattened our curve in April and in May. And so let's use this to remind ourselves and motivate ourselves that we can and we will do this again. But there is absolutely no time to wait. Thank you, Supervisor.
Thank you again, Dr. Fitzgibbons, for joining us today and for your important message. I'm also very pleased that Ellen Barger, the Assistant Superintendent for Curriculum and Instruction at the Santa Barbara County Education Office, is here today to share information about the local impact of the governor's announcement today regarding schools. Thank you all.
Thank you, Supervisor Hart. The governor's announcement today comes at a time that our school districts have been struggling with the very difficult decisions about school reopening, trying to balance keeping children safe and getting the benefits of in-person instruction. So today the governor announced the new criteria and guidance for California schools serving all students from transitional kindergarten through grade 12. And this guidance is for all public, charter, and private schools. The order states that schools may reopen for in-person instruction at any time if they are in a county that has not been on the county monitoring list for 14 consecutive days. So as you have heard from Supervisor Hart and Dr. Del Reynoso, Santa Barbara County is on that monitoring list. So what does that mean for our schools? It means that all 20 school districts, all charter schools, and all private schools in our county are not currently authorized to open for any in-person instruction. School campuses will remain closed, and all districts and schools will be prepared to offer distance learning. Once our county meets the metrics and is no longer on the monitoring list for 14 consecutive days, each district, charter, or private school will make the decision about whether, when, and how to shift to an alternate instructional model. It's important to note that the superintendents and heads of school and the directors from the 20 districts and 5 site-based charter schools have been convening at least weekly since April with our County Superintendent of Schools, Dr. Susan Salcido, and our Santa Barbara County Education Office staff to collaborate and plan for all scenarios around reopening. Districts have been planning for the potential tightening and loosening of health orders and anticipating changes in epidemiology and local community factors. So this has included reading and interpreting every set of guidelines and plan templates released, consulting repeatedly with public health, researching approaches up and down the state, and modeling a vast array of structures and approaches to determine their feasibility, costs, and consequences. So in the coming days, individual superintendents and heads of school will share more specific plans with their school communities. We will receive more specific guidance from the California Department of Education on Monday. I know that many people are concerned about distance learning, and the distance learning that we will have in the fall will look very different than the distance learning in the spring. In the spring, we were in crisis mode. Everyone was responding to the initial crisis and focused on school nutrition, connectivity of internet, and maintaining engagement and the social emotional needs of children. At the same time, we were trying to finish a school year that was interrupted without warning. Also, at that time, the state offered flexibility in the areas of assessment, attendance, grades. But by contrast, the new legislation that is out, the planning that has happened over this summer, means that there will be expectations for distance learning under these new conditions, and they require robust, rigorous standards, daily attendance monitoring, regular assessment and progress monitoring and communication of grades with parents and students will have daily synchronous interaction with teachers. So in the coming days and weeks, expect to hear more from your individual school districts about the immediate plans and medium and long-term plans. Finally, we know that the distance learning model truly impacts our community in many, many ways. The child care and supervision needs of our children and teenagers, for parents who need to work, for employers who have children. We all need to come together and think about how we can support our children, our teenagers, our schools, and each other as we work hard to beat our numbers, to get our numbers back where they need to be, and so that we can eventually open schools safely and for the benefit of our children. Thank you.
Thank you, Ms. Barger, again for being here today. We'll now go to questions from the room. Mr. Devine?
Before I get to my questions, did you guys say the total case count?
Yes. So the total case count is 4,759.
Thank you. So first question, just talking about schools and remote learning. The governor mentioned that the quality of remote learning needs to be the same quality as in person. How are you guys going to ensure that that happens with the fall?
Yes, so each of the school districts, all 20 school districts, charter schools, and private schools have been working on their processes for distance learning. There are clear standards. They have increased connectivity, working on getting devices out to everyone. And as part of the trailer bill language that came out 2 weeks ago, there will be plans that will be available to the public where each and every school district will talk about how they are meeting those requirements in their learning continuity and attendance plans.
Once schools are allowed to reopen, hopefully, if we get our numbers back, just tell me the process of how schools are going to be allowed to reopen given differences in schools being charter or private or district.
The main difference doesn't have to do with the type of school that it is. As our schools have been planning under these guidelines, When a school is off, when a county is off the monitoring list, each individual school district or charter will make that decision. That decision will still be based on meeting all of the other criteria, which includes the ability to provide social distancing, all of the hygiene, and the face coverings that were also covered in the governor's news conference today. And so the districts have been creating these alternate plans, hybrid and full in-person model. They will then make the individual decisions about how to transition from full distance learning to these different models at the time that's appropriate. And they will create and fill out the attestation that is required by the county that shows that they have met all of those criteria and guidelines at that time. And so all of that will happen with communication with the public and through the school boards.
Thank you.
Thank you. Mr. Bolton?
Thank you very much. I have several questions today. I'd like to start out with Dr. Dona Reynoso. We've really struggled to understand your numbers. They seem to move around quite a bit. Cases come, they go. They don't match the state numbers at all. And I'm wondering if you could give an explanation. I've inquired and don't feel like I've really gotten that answer yet. So.
Sure. So I too share that frustration, why our numbers don't match the state, because there's always a lag. And we have been, personally, I have been in conversations with my team, with CDPH for the past 3 weeks. Help us understand, we've asked the state, help us understand your methodology. Give us the sources of your information. And we went as far as asking, give us the SAS coding so that when we run the numbers, we match. And unfortunately, the state has not shared their coding, their methodology with us. What we know is the data source. We don't know what the parameters are. So it's a continual conversation. So last Wednesday, I was very frustrated because I've gotten your emails. And I basically said, you know, we owe it to our community to have numbers that show that we are clearly tracking the disease in our community. And it puts us in a really uncomfortable position when our numbers don't match with the states. And so what I got, it was just a lot of round conversation. So finally I said, okay, so why don't you footnote on your dashboard that there will always be a lag because our methodologies are different and we don't know how you do your numbers. And so that's what our ask is, and I'm hoping that at least that caveat will be posted on their dashboard. And even so, if you look at the different dashboards on the state site, there are discrepancies between the state's websites as well. And because different departments, the governor's office has different metrics, different methodology versus CDPH. So that's why the numbers are different. There's a lag, there's different methodologies.
Okay, thank you. Another question pertains to a number of businesses and whatnot were closed down in the last few days. One of those was salons and barbershops. And of course, the directive was that with all these businesses, they could move outdoors. The state licensing agency for them said, no, we're not going to let you do that. And I guess I'm wondering what, if anything, the county is doing to try to maybe help those people out. Because it seems like in a lot of cases, that would be as appropriate as many other activities that are being done outside.
Right, and not only hair salons and barbershops, but also tattoos. They can't be done outside. And so we are also seeing that inconsistency, and we are advocating to the state, give us some clearance. Will the state boards give some allowances? Are there allowances that the county can support? So that's in conversation.
Okay, so you are talking to
Yes.
them about that. Okay. The other thing is we asked a while back for much more detailed information about hospitalizations.
Yes.
And thus far, we have not gotten that information. I'm wondering where that stands.
So we receive information from one hospital. As of today, we received this data from the second hospital, and we're waiting for the third hospital. So we have the basic demographics that you've asked for. Every hospital is struggling to get the data on the comorbidities, the underlying health conditions that you've asked for. But for the most part, the age and the race and ethnicity, those are easily gotten, but the underlying is a little bit more difficult.
Okay.
And so I actually am waiting for the third, and once we get into the format, a format that we can do, we'll consolidate it and share it with the public.
Okay, appreciate that. My last question is for the doctor from the hospital. I'm just curious what toll this is taking on, you mentioned all the medical personnel. Obviously, some of them have gotten sick, but what toll is this taking at this point? I mean, we're going at this now for 6 months. Psychologically, emotionally, I mean, are they just getting burned out? Especially when you see it coming back.
Great question. I think that for the most part, morale is high.
Really?
I think that's the case. As I said, though, we're talking about thousands of our community members. And the hospitals are one place, but the reality is every outpatient clinic who is facing a patient walking in of unknown COVID status is of course living this right alongside the ICU nurse who's managing a ventilator. And I think there have certainly been ups and downs. I think that as with our entire community, I think that there are people that are certainly struggling with not just the intensity of what's going on, but also the part that I said earlier this week. It's the longevity of it. It's the fact that there just is an absence of a fixed point when we know it's going to go away. And what does that mean in the hospital? I think it means that we've hit a good pace, a sustainable pace. I think as things continue to worsen with regards to the case counts in the community, I think that is hard on a lot of us every day. But I think some of you know I'm a runner. I think I used a silly metaphor early in all this and said this isn't the State Street Mile. This is clearly a marathon. I think we can say in July this is now turning into a 9 trails or an ultra marathon at this point.
Okay, thank you. Thank you all for your answers today.
Mr. Bolton, I'd like to add something to it that sort of fits the theme of your questions. The systems that look to the public as though they are perfect and they are machines and the data is being spit out from computers is being created by individual people who are working very long hours for a very long period of time at the hospital, at the County Department of Public Health, and at the State Department of Public Health. And so all of these systems, are, with humility, people-based, and everyone is doing the best they can to make these systems work and trying to collaborate as best they can, and it is not happening perfectly because we are people.
Yeah, and I certainly appreciate that, Supervisor Hart, that there's no question that people are working hard, people are working long, just as you all, just as my colleagues in the media are. But I think it's still important that we press for answers on these questions. And, we've tried and I think had fairly good response from the Public Health Department and others in getting those answers.
And if
So it don't mean to impugn anyone. I hope.
And I didn't mean to take it that way. I
Okay.
just wanted to make sure that the public understands, the expectation of perfection is not realistic.
Right.
We're all doing the best that we can, and we're providing the information in real time as comprehensively and fast as we possibly can.
Right.
And there will be mistakes by that
Sure.
system. So-
And I hope you and the others understand that a lot of the questions we ask are questions that come to us from
Yes,
the public.
completely
I get
understand.
emails every day. It's like, what about this? What about that? And there's some really good questions.
Yes.
So,
If I may add, I also realize the importance of the hospitalization data that you've requested. So I actually made that request to CDPH repeatedly and finally got the answer on Wednesday. No, we have other data requests that we need to work on. So we hear you, but we're going to put in this pile for now, so.
okay, again, I appreciate your answers.
Thank you, Mr. Bolton. We'll now take questions on the phone.
Yes, first up, we're going to go to Josh Molina with NewsHawk, to be followed by Raisa Georgie with San Ynez Valley Star. Go ahead, Josh.
Thank you. I hear that the greatest risk is indoors. I understand that, and I understand that outdoors with a mask is a lesser risk. But I also think we probably need to do everything we can. So in that context, I'm wondering, has the county thought at all about the State Street promenade and the 9 blocks that are open? I mean, we're talking about large gatherings. We're talking about people wearing masks. Obviously, the restaurants need to have their outdoor dining, but it's probably not a coincidence that as soon as State Street opened up to groups of people in the street, it was around the time that we started to see the cases come up. And along those same lines, City Council also facilitated a block party on the west side a couple weeks ago, where they closed the streets of cars and lots of people were there and gathered. So I wonder, there's a lot of focus on business and the liberties they might be taking in the office. Can the county step in and say, we need to do everything we can right now, and why are we facilitating large groups of people gathering?
Well, I think one way to look at this is that the spread of the infection is happening in every community in the county. Lompoc, the numbers are up by 25%, Santa Maria, 25%, Santa Barbara, 20%, Goleta, 19%, the San Ynez Valley, 53%. So the correlation in people's minds between State Street and the spread of the infection is not a statistical correlation. That might be an easy thing to look at and see, but the things that are invisible that I was talking about, gatherings of family members, couples having dinner together in their home, things like that are driving the spread of the infection, not the visible, obvious things that people reflexively go to and say, those people are causing this problem.
So are you saying that in the contract tracing, nobody has said that I've been downtown on State Street?
I'm saying that the focus of our attention needs to be on our individual and family behavior and work behavior, because that is the largest contributor to this challenge. And I think it's a mistake to focus on the things that are visible and obvious as opposed to the things that are invisible and insidious.
Right, I understand that, but I thought sort of like every little bit helps was sort of the mentality that the county was trying to project. My other question is this is for the county education office. What about sports? The schools are going to start remote distance learning. Will there be after school sports? Is that a CIF decision, or how does that work?
Thank you for that question. I think many parents are wondering that. Just prior to the governor's order, we had actually moved backward in the CIF phasing. So CIF had put out, in conjunction with the California Department of Education, informed by the California Department of Public Health, a 2-phase model, whereas phase 1 was about the ability to train and condition. And then phase 2 would have been to actually practice the sports. Once we had the change to the health orders where we could no longer have indoor gyms, there was no more conditioning. And so right now we're at a standstill with sports and other after-school activities that would put students into close contact with one another.
And not all sports are the same, like football maybe, but other sports, you don't have that same physical closeness. Is that being considered at all?
Absolutely it is. That's very clear in the CIF guidelines, that they really do look at different sports creating different amounts of physical interaction, that have that. And so when the initial guidelines came out, there was talk about individual running, track and field, cross-country type events. But most of the other events are still very unsafe. And so the CIF guidelines are constantly being aligned to the local county health guidelines. And right now we're at a place where there are no after-school sports.
Okay, thank you.
Thank you, Mr. Molina.
Next, we're going to Reza with San Ynez Valley Star.
Hi, this couple questions is first for Ms. Fitzgibbons. I'm wondering on when people are identified as, COVID positive, are you guys starting to work with them immediately on various treatments? Like there's been some articles published from some doctors in Texas, particularly that budesonide or like an inhaled corticosteroid is, working wonders, and they've seen 100% success rate with their patients and getting better quickly from treating it early. So I'm just wondering what Cottage and perhaps other hospitals or even, local doctors are doing to combat this early instead of getting to the point where people are ending up in the hospital.
Great question. So question with several parts. So this is an absolutely unprecedented time in evidence-based medicine. We have perhaps the most pressing set of health questions related to the health of our global population. And until January of this year, we didn't know anything. And so what that means is there's been a feverish pace of pre-published information coming to the medical community, literally 24/7. The news cycle for media is 24/7. The news cycle for clinicians and published data in every publication from the New England Journal on down is literally 24/7. What we also unfortunately have access to is a lot of anecdotal data. And the problem about anecdotal data is the plural of anecdote does not truly make evidence-based medicine. That's all to say that as early reports of successes from anywhere around the world are talked about and published, they are getting, I think, the appropriate attention. And I did review the information you're talking about earlier today, and I'm looking forward to hearing more about it. But again, I think we have to be very careful not to pivot too quickly in response to reports too early that could ultimately impact the health of a lot of people. At this point, what are we doing locally? I think we are continuing to communicate every 2 weeks through the Cottage medical staff updates, really a summary of the up-to-the-minute clinical information and what's available. And we're reviewing, again, very regularly what the national guidelines are, what the National Infectious Disease Society of America is telling us we ought to be doing at this very moment. We're also reviewing, again, data in well-cited sources that really should inform how we're treating the patient who we're going to see in the afternoon. And so I think in our community, I really think that we have been cutting edge. I think it's appropriate to be cautious when we hear reports of something that is having a miraculous response. But as you point out, I think very interesting and exciting news coming from a variety of places in the last week, and I'm really looking forward to hearing more.
Another question regarding the positive cases is that there was another article published by a German virologist, and he's saying that some of these positive cases are not only just picking up the live virus, but also the dead virus as well. So somebody who may come into contact with it and not be showing any symptoms. So I'm just wondering, does our current testing have the capability of detecting live versus, dead virus?
Wonderful question. So remember that a virus by definition isn't an organism, so we don't really think of it as being alive or dead, but we think of it as being able to replicate and continue to infect new cells or not. And,
Right.
And your question is spot on. The PCR test, so again, we talk about all the different types of PCR tests, but the PCR test that diagnoses in the back of the nose, the back of the throat, the front of the nose, that swab, that test that makes the diagnosis of a confirmed case that Dr. Dervinoso tells us about every day, that test is a PCR test. That does not tell us whether the virus is capable of continuing to infect another cell or not. The only way to really do that is a very labor-intensive technique called cell culture, and that's not what anyone is using at this point. What you point out is the German study where they took a small number of patients and they actually looked how long did they continue to have a positive PCR, but they also studied all these samples. How long did they continue to have a culture that confirmed that that was still an active virus. And as you pointed out, 9 days was about the limit, where after 9 days, even though the PCR kept picking up evidence that there was a bit of virus around, after 9 days, there didn't seem to be more virus that was able to go on and infect other cells or perhaps other people. All that in mind, the health department, absolutely spot on consistent with our state health guidelines, with our national health guidelines, has really refined when we consider a patient to be infectious and that period of infectivity. Again, this is a work in progress, but the data that we have right now suggests that after about 10 days of symptoms, it is quite unlikely that someone will continue to be infectious. Quite unlikely. We still, however, for at times weeks after that 10th day, continue to pick up a positive PCR, which again suggests there's bits of virus there, but not necessarily active virus.
Okay, that better explains that. And thank you.
You're welcome. Thanks for the question.
And my other question is for the school superintendent, assistant superintendent. How a lot of parents are very concerned with what is going to happen moving forward, especially working parents where, you know, both parents have to go to a job. They cannot stay home. I know of somebody who had to leave her, you know, 5th and 2nd grader at home alone. And how is that responsible on the school level, you know, to create these situations? You know, if something had happened to her kids during that time, you know, parents are very concerned and worried. And if they don't go to work, they don't make money, they don't pay mortgage or rent or bills or anything like that. So how are you trying to help combat those nerves that parents have right now?
What you bring up is probably the most difficult question for all of us to figure out exactly how we are going to do these two things, how we're going to keep our children safe. And what our governor has said is the way that we're going to keep them safe is to keep them home and do distance learning. And so, as you mentioned, this will have a huge impact on employers, on parents who need to go to work, on our entire community. Many of our districts in all parts of our county have been working already with our nonprofits, with the philanthropic community, with resource and referral, with all of the different agencies that work together to not only provide childcare, but to match folks with childcare. And this is not something we have ever faced before. Many of our districts were planning in the past few days to be able to go back fully 5 days a week. And so they will pivot and we will work together. And that's why we're asking for the support of our entire community to make this a priority so that we can continue to have students have support while they're in school, in their distance learning, supervision to keep them safe, and so that parents can do what they need to do. We don't pretend to have the answers from this morning until now, but we have been working on it and will continue to work on it. So thank you for bringing attention to that, because it's something that is weighing really heavily on all of our minds and that we will be putting our efforts into over the next weeks.
Thank you, Reza.
Next up, we're going to go to Brooke Holland with News Hawk, to be followed by Laura Place with Santa Maria Times, and then Grace from KCSB Radio. So, Brooke.
Okay, hi, thank you. This is also for the County Education Office. What is the plan to meet the needs of special education students with remote learning this fall?
Thank you, great question, and thank you for bringing that to the forefront. When I was talking about meeting together to plan and to collaborate, throughout all of those collaborations, the director of our Santa Barbara County Special Education Local Plan Area, the SELPA, which coordinates special education services throughout Santa Barbara County, has been at the center of that work. And so each and every district has been working on that plan specifically to make sure that they are providing a free and appropriate public education for every student, meeting the needs of their individualized education plans, and giving a lot of thought to how they will give and provide all of the services to which the children are entitled. And so within these plans, within the planning process, they have also been reaching out to parents and communicating to the parents, because they have been providing extended school year services to the children as well. So that is right on the top of everyone's mind, and we will be working with each of our individual districts through the special education local planning area to make sure that the individualized plans for each and every child is considered and put at the forefront in determining how they will receive their education.
Okay, thank you.
Thank you, Ms. Hahn.
And now we're going to Laura Place with Santa Maria Times.
Can you all hear me okay?
We can hear
Yes.
you fine.
Great. My question was regarding the outbreak at the alcohol harvesting H2A farm worker housing, and if there's any update with that investigation by public health, as well as whether any more residents there beyond the 14 announced earlier in the week have tested positive.
Yes, so as of yesterday, we have 40 in isolation and quarantine associated with the ALCO H2A housing outbreak. And the Public Health Department, as well as ALCO and their infectious disease consultants, are working closely together to do disease mitigation.
Okay. So are there like next steps in the investigation that need to be taken, or is it just continued consultation?
It is we are taking, we're considering the outbreak as a congregate outbreak, so there will be serial testing. And again, we are working closely with the disease, the infection control specialists that ALCO hired. And so we will not close out the outbreak until we have clear testing for 2 weeks in a row.
Okay. And just to make sure I understand, when you said 40 individuals in isolation and quarantine, is that 40 who have been confirmed for the virus, or are some of those results still pending?
I believe that those 40 have they are confirmed positives.
Okay. Okay, thank you very much.
Thank you, Laura.
Ms. Place.
And we'll wrap up our media questions with Grace Aldrich with KCSB Radio. Go ahead, Grace.
Hello. My question is directed towards Dr. Fitzgibbons regarding the recent change from this reporting from CDC to HHS, and I was wondering what impact that has had on Cottage Health and just the reporting in the hospitals.
Sure. So the background to the prior discussion of reconciling data from different data sources, of course, starts really on the reporters, at the reporter level. And so what do I mean by that? I mean, really, as far back as I think the first or second week of March, there was very strict mandated reporting, of course, around the country and here in the state and here in Santa Barbara itself. We have a team of people at Cottage Health, and I think every healthcare system has the same, essentially mandated to report a set of discrete fields every single day. And so the change that you're describing, and has had a lot of interest this week, really has been a change that, as I understand it, will go into effect next week, and essentially changes, of course, who we are reporting that data to. I believe that the majority of the data that is being reported is going to be very similar, although I think there is some modification, perhaps a small number of additional fields that we are going to be mandated to be reporting. The million-dollar question, of course, is not so much related to the input piece, but rather what data are we going to get on the back end, right? What are we as a community, as a public, as a country going to see? And it's being, I think, told to us that this should be an improvement in the data that we're going to be receiving. There are certainly varying opinions, and I won't comment on any of those opinions. But what I will say is, it's really very, very premature to make any assumption or determination of what kind of data we'll be getting on the back end. And all I think I can say is that on the front end, is on the reporting side, a very similar set of data, but not identical.
Okay, and in the way that you report it, is it a different, do the nurses and reporters have to learn a whole different set of, like a computer system, or is it gonna be a pretty smooth transition over?
My understanding, so it's actually not healthcare workers who really provide this reporting. This is really a kind of a high-level administrative team, really within most hospital systems, who are doing this reporting. And of course, this reporting is nothing, it's certainly more intense with COVID, but of course, healthcare systems always have to report metrics and data really to the government agencies. And so it's that team, that data team, that will continue to report. I understand, as I said, it's a different system, but I'm not one of the reporters, so I'm sorry I don't know the details of which system, the technical details of exactly what the change is going to be.
If I may add to that, so on the county side, we get the hospitalization data from CDPH. And so I'm a little bit worried with the transition, how accurately, how different, and what's the lag time, because hospitalization data is critical to us. That's what we report out on our reopening metrics. So Tom, you may see a little bit more glitchy data next week.
Thank you, Grace. And that's all the time we have for questions today.
Thank you. Our next press conference will be Tuesday at 4:30 p.m. Beginning next week, we will resume the twice-a-week press conference schedule on Tuesdays and Fridays. If you have any questions, please call the county's call center line at 833-688-5551. Please continue to practice these 3 simple steps as a person every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. Number 3, if you feel sick, stay home and isolate yourself. If your symptoms worsen, call your doctor or clinic and follow their medical advice. Please continue to be patient, considerate, kind, and safe. We will all get through this together, and thank you for joining us today.